Welcome everyone, and thank you very much for joining us today in this webinar organized by CIMTI. I am Elisenda Casanellas, Chief Operations Officer at CIMTI, which is a healthcare accelerator of startups promoted by the Health Department of the Catalan government, and it's promoted by l'État. I'm very glad to be here today in this webinar where we are going to discuss about value-based healthcare, because it's a topic of growing importance, and we're going to talk about creating a more value-efficient and sustainable health system. To do so, we have invited two international experts, which are Rossana Alessandrello, value-based procurement director at AQuAS, which is the Catalan agency for evaluation and quality in healthcare, and also Yves Verboven, founder at EU4HealthSolutions. They are going to discuss topics such as value definition, framework to dialogue between the demand and the offer, pathways towards the adoption of solutions delivering the expected value, and the assessment of solutions to demonstrate that they bring to the demand the expected value. What we're going to do is now I will briefly present the speakers. After that, they will give a speech of about 30 minutes, and after that, we will have some time for questions and answers. So we have Rossana Alessandrello, the first speaker. She's the value-based procurement director at AQuAS, as I said. She's MS in electronic engineering from Politecnico di Milano. She's specialized in bioengineering and certified in business administration from the Manchester Business School. In her role, she supports the healthcare providers of the Catalan health system in identifying their unmet needs, in assessing the business cases supporting the relevant investments, and in designing cross-border value-based risk-sharing public procurement tenders, pre-commercial PCP or of innovation, PPI. On the other hand, Yves Verboven operates since 2021 at EU4HealthSolutions. His key role is to act as senior advisor to MedTech Europe for strategic files, and as an external consultant to initiative fostering the accessibility of innovation and accelerate adoption through a value-based approach, especially through value-based innovation procurement and accelerated coverage pathways for innovation. In the past years, Yves transformed the market access focus on MedTech Europe towards a value, innovation, and access and economic policies at MedTech Europe, striving for an innovation-friendly ecosystem with timely access, innovation, and appropriate recognition and rewarding of the value created by medical technologies. As you can see, their CVs are a lot longer than that, but I tried to do a shorter version to show that they are experts with a wide range of experience in this field. So, having said that, I don't want to take any longer. Please rejoin your cameras and we can proceed with your speech. The floor is yours. Thank you very much.
A big thanks for the invitation and the opportunity to present the views which we have been further developing from the medtech industry side in this topic of value and value-based healthcare. And I think a clear starting point is really that when thinking about value, it's really a revolution in mind which is needed. And then, of course, we need an evolution towards the implementation. So if we go to the next slide. If we see somewhat where the challenges are from a health systems and the healthcare delivery perspective, is that we all realize they are under mounting pressures by actually getting now and over a long time already having large unwanted variation in the quality of the services which are provided, the outcomes which are being obtained. There is the economic crisis, which I know in Catalonia have been quite strongly hit on as well, which then puts to question the healthcare provision. And there is at the other side also an unsustainable cost increase, percentage of spending from the GDP which need to go into healthcare is increasing, given that the economic growth is not in line with the expenditure growth. And there is the wide variation of this care delivery, which moving into cost containment will actually move to further negative spirals. So if we go on the next slide, the question is then, how do we want to tackle this side? And in our view, to address these challenges, it's critical that health systems need to really focus on improving the value of the care delivery, and not solely focus on the volume, the cost, the single clinical indicators, and also what technological innovation can do, but really moving from an offering, a supply side, an input side, to really looking at ultimately what's the output, how can we keep patients in good health, how can we further integrate the care to really address the challenges and the limitations which are currently in the health system. So if we move on the next one. So if we think about value, as my CEO always indicate, Yves, I mean, people have been talking about value. I mean, when you're offering technological innovation, you're certainly going to put your propositions forward of what value the technology can bring. But what's critical is that we shift the thinking from not what we can do in the offering, but really what and how can we respond to the specific demands. So what's value in our view, and that has been put into a two-pager which we commissioned, and Professor Atun and co-workers have been writing this up. It's really when we think about value, it's to consider what's valued, and from an industry perspective, ultimately also where there is a willingness to invest in from the healthcare system side. What's valued to address the unmet needs, and this conform to the values that the society is putting forward. And this can vary from one country to another country, from one jurisdiction to another jurisdiction, but this is somewhat the basis that we want to start from. So if we move on the next one. So when we think about this view of value, then this value will put the patients and the person's outcomes, as well as the economics at the center, and really is aiming to offer a win-win situation with clear benefits for all stakeholders. So if we look at the providers, procurers side, they are able then to improve patients' care, financial sustainability, bringing clinicians, nurses, procurers, and budget owners together to jointly improve the care and address the expectations. From the industry side, and you as entrepreneurs as well, to really become part of the solution and to be ultimately rewarded for the value contribution that's being done, and to bring then the innovation in the care improvement. And also for the healthcare systems, they can truly leverage this to get a greater value of the resources invested and address also their financial concerns which they have. So this, from my perspective, on when thinking about values. If we move on the next slide. I will then hand it over to Rosanna to give then the perspective from her perspective in this regard.
Yes, thank you, Yves. Thanks for this handover. As you can see, and always you will see, Yves and I, we are really strongly aligned with the way to approach the value in healthcare and the value-based healthcare. Although we come from two different perspectives, because at the end of the day, we need to know from one side, the demand and the offer, they need to work together. So if if we are misaligned, we will not meet our objectives. And really, if we want to see it from somehow from a historical point of view, the concept of value healthcare has been somehow not always clear. There has been a lot of definitions, and it's interesting, apart from the exercise that really did Rafat Atun, that now Yves was mentioning, regarding how also define the value, in economics, no, infatti Rifana tu also is an economist, the concept of value has been defined across the last 2 centuries from different current of philosophies, and then Michael Porter arrived in 2010 and said value is the health outcome achieved per dollar spent. But this was not really satisfying the different other stakeholders that we can find, like patients, like why not HTA agency like AQuAS is attached to the Department of Health, like hospitals represented here by the European University Hospital Alliance, or like healthcare professionals that also individually they try to understand what is value. It's interesting that each of these stakeholders that I identified here in this list, they highlight different attributes to the word value or to what value-based healthcare is. It's interesting, for instance, to see that patients clearly, and also most probably more appropriately, are not looking at the finite budget that the healthcare departments have to provide the healthcare services. And consequently, they put emphasis on what is value for them, their autonomy, the fact that they are unique, and they want to be listened. An entity like AQuAS, that this exercise to define what value-based healthcare is, since it is an evaluation agency, put emphasis on the evidence-based care, evidence-based evaluation, but also, why not, to the fact that we can have we can reduce the resources to increase the outputs that we deliver. Or when we talk about efficiency cost, maybe we can also somehow invest the same resources, but again increase the outputs. And so these efficient and cost intervention are key also to decide where then at the end of the day the policymaker need to take a decision on when to allocate a specific budget. The European University Hospital Alliance, they are looking at their perspective of healthcare delivery. So they are looking at the hospital resources, and not only, they are putting emphasis on that we are not just talking about healthcare professional, but we are talking about other, for instance, support services. Why not the clinical, the clinic department, the ICT department, the maintenance departments. And also they're putting emphasis on the fact that we are talking about a collaborative approach. No healthcare professional, no hospital can do it by its own. If all the departments or the units need to be integrative, collaboratively work together, the delivery of value to their stakeholders. And healthcare professionals like Jan Hazelstedt, that has been one of the key healthcare professional leading the adoption of value-based healthcare across Europe, start to think about, well, when we talk about the dollar spent, what is the dollar spent? Maybe we should look at the full cycle of care. And again, not only when we need to look at the patient-centered care, healthcare delivery, but also not only we need also to be effective, efficient, safe, timely. So the value is delivered in a specific time, maybe not too late, or maybe not too early, equitable. We need to guarantee that we deliver in equity healthcare, and also sustainable over the time. And this, this also sustainability was also a key aspect from AQuAS. So what I'm trying to say is that for each of the stakeholders, we need to understand what value we are delivering. And on purpose here, I'm not putting any icon representing the industry, because as Yves was already introducing, when we want to ensure that we are delivering value, we also want to make the approach of demand-driven healthcare delivery, demand-driven intervention. So here I'm representing the demand. I'm representing the demand with the patient in the middle and the carer in the middle, this informal carer, the health professional, the healthcare provider, the health system, and this icon that represents somehow the society, no, that also needs to be to receive a value every time that we want to support an initiative like value-based healthcare. So let's move on, and Yves, the word is yours.
Thanks. And so, as you can notice, there is, of course, some multiple views then of what actually then constitutes value and what is valued, and certainly from the health system side or for the healthcare provider, it's then of course important to identify what ultimately is going to be valued and what's going to be interested, that people say, okay, this is something I truly want to invest in. I want to finance your innovation that you're bringing. And so to facilitate this dialogue, because ultimately it is just a common agreement of what people appreciate. It's not something that you can predefine. You need to have this dialogue. That's why it's important to have the appropriate frameworks to do this, to facilitate this. So if we move on the next slide. What of course is put forward is this view, which is primarily coming from the US and realizing how the health systems in the US are operating. It's of course critical to ensure that the outcomes of the patients are really at the center. And this is something from US healthcare systems what they primarily are focusing on. And of course, they want to ensure that the cost side is as low as possible to deliver this, and moving them from the input side to really the output side. So this is, I think, from a US perspective, and I noticed a couple of questions. Okay, where is the link between the outcomes and then the economics? And in the US, this is somewhat the view of how to match the two. If we move to the next slide, if we look a little bit at how this is then implemented, we see multiple initiatives going from Michael Porter's Institute, Value Institute, from the World Economic Forum, the G20, EIT Health, expert panels. So people are looking at it from a system perspective to have it implemented. But if we go on the next, if we then see how from a technology perspective and from an offering perspective, we can actually contribute to this. I think there it's important to see also how we're moving from a technology development perspective, where ultimately we go in a negotiation of what's the volume and what's the price to have for this technology, towards really moving into, okay, ultimately what's the value that we're offering, what is the value that we're creating, what's the value of the technology, what's the value of the diagnostic information which is being provided, and what's the rewarding for that value, even moving into what is actually this technology being part of a solution which is being offered, a solution together with services that are being offered. And again, how is this being rewarded? And can go very advanced to really take care of full parts of the pathway, where the industry takes on this new role of then actually trying to do this as efficient as possible, having the right metrics put in place, and then getting some agreements which are being put in place in order to get the rewarding for this. But so this is somewhat from a technological perspective important to see how we're actually going to be able to contribute within such an environment of moving the system also to a value-based system. And in order to facilitate then the dialogue, we go on the next slide. We created actually a framework by asking what the providers are interested in. And so by going into the analysis, we actually then facilitated to compile this into different categories, different layers. And so at the core, we of course keep, of course, the outcome for the patient and also the cost of this care delivery, but looking really at the full care delivery. So the full care pathway, what's actually the cost of this care pathway that we have, and here already the economics are coming in. So this at the core, but then also what's actually the value, secondary value for patients, for the healthcare professionals, for the system, for the providers. And then actually a third layer is looking beyond the health system and the health systems actors, what actually from a policy and from a societal perspective there is interest in to obtain. Currently, of course, the whole environmental question is very high on the agenda, sustainability aspects, also bring innovation into the systems, helping to transform the systems, having the broader societal economics impacts which are being obtained. All of those are elements to be discussed if people ultimately are willing to invest in those, and prioritization can be done to see what is actually the most important one, and by that actually evaluating one offer versus the other offer. So if we move on the next slide. So moving a little bit more into detail. So we have these different layers, we have then different categories that are being identified, and there are different criteria which actually fit to those, which people can identify and making the overview of ultimately what is important to be considered in the decision making. And in order to come then to seeing ultimately from the buying side of bringing systems into the health system, so bringing innovation into the health systems, the evaluation is done by a type of multi-criteria decision. So you're looking at the value propositions. You're looking at what's the monetary value for that one. So what are people actually willing to invest in order to bring those into the systems? From the other side, you have the cost components, the cost components which can be optimized if you optimize efficiency into the system, and ultimately what's economically the most advantageous solution is actually if you subtract the two. So which one that you actually have your cost components, you deduct the quality in monetary terms, and the ones which is then getting the lowest is actually economically the most advantageous. And this is something that we increasingly seek to apply in the purchasing, the procurement arena. So if we move on the next slide. Again, like to turn over then to a little bit more from the theory to the practice from how this is being done in Catalonia.
Thank you, Yves. Okay, to foster a change into the health system, really now in Catalonia, we have several initiatives. I'm not mentioning on purpose CIMTI because already CIMTI is organizing this event, so somehow it would be somehow repeating, but I'm going to mention other initiatives like PIPI, that is a community of practice that we are now running together with European Alliance of European University Hospital Alliance, ARES, that is an education program, but also well, we had also EURIFI, that was another community of practice in the public community of innovation together with Yves. And also there is this new program that has been announced on the and published issue really from the Department of Health on January 25th, that is creating this commission for the innovation and transformation of the health system. So really we have a push from the Catalonian Department of Health to adopt this kind of way to work from different in different channels. And in any case, if we look at how also we can foster a dialogue case by case, we can see it in different ways. To foster the dialogue is also between exactly not only among the different stakeholders, as I was mentioning in the previous slides, but also really from between the demand and the offer. And now I'm going to relate some examples. For instance, Radar. Radar is a public procurement of innovation that just started the project, not the procurement activity started at the beginning of January, and we already launched a PIN, prior information notice, to announce the market this is going to happen. This acknowledgement for the market, we consider this very relevant, because so now the market can be already ready that something is happening in the rapid detection and control system for antimicrobial resistance. And this is a very important starting point to foster dialogue between the demand and the offer. Then we have the market consultation. The open market consultation again is launched through a PIN. In the case of Radar, we are not ready yet for an open market consultation, while this we have an example of a pre-commercial procurement called TICE that already finalized the market consultation some weeks ago, and now we are in the phase of defining the call for tender to be launched soon. Why we are not ready in Radar, while in TICE we already did it, because we had to define very well before talking with the market and clearly fostering the dialogue with the market, understanding very well our needs, understanding very well why these needs are relevant for us, what value we bring to each of these different stakeholders, how this can be sustainable over the time, why we are bringing this value in this moment and not in another moment, and consequently, it's you need to know how to express all of this to the market in a way that then they can understand if really they have mature solution or not, or they need or they have R&D that can be together can build a solution that then ultimately will address the needs of the demand side. And then we have anti-superbugs example. Anti-superbugs already closed at the end of February. It has been a pre-commercial procurement, and yes, across the pre-commercial procurement, where we are contracting R&D services, we are sharing risk and benefits between the demand and the offer, and we are fostering dialogue across all the phases, from the solution designing, the prototyping, to the proof of concept. Because in all these phases, we have the demand and the offer working together to ensure that we align ourselves, and the solution that at the end of the day the market will offer will be aligned with really the needs that the demand was defining. Yves, the words are yours.
Thanks. So now that we have tried to put somewhat the thinking on, okay, what does it mean if value, and what's the value propositions that can be put forward, and then also how to then enter into a dialogue mode, trying to have a same basis for the dialogue with the framework, or facilitating this also through what Rosanna indicated, the market consultations, the market dialogues, which are taking place, which are critical, and which to my understanding, given that you're coming from a practice, you already have a good feel for what is needed within the care delivery. The question then comes into okay, what's the pathway for the access aspect of this innovation? And if we can move into the next one. And so what we have been working on from the medtech industry side is that it's important to realize the challenges that are ahead to actually get the technologies certified to be put onto the market, but even more critical then to ensure that there is an adoption and a first access of this innovation into the health systems. And of course, the health systems are, with their challenges that they're having, quite critical in order to just get additional innovation into the system. So it's important to be very well prepared for the different phases, and to also have a very clear view of ultimately what is the value that you truly are bringing in the eyes of the system, or from the healthcare provider, or for the patient, ultimately dependent on who will help you in getting some financial and revenues, and so rewarding for the offering that you bring. And so what we have put forward is moving towards a model which is not only looking at the development of the technology, then have it certified and just push it into the market, but really seeing, okay, how can we move into a more collaborative approach into the value of innovation and partnership building. And so the first step is, of course, to define the unmet need. The unmet needs which can be there from a patient perspective, from the healthcare perspective, but also from a health system perspective, of the efficiencies, addressing the waste, addressing the complications which are currently in the systems, how to get better integration being obtained. And based upon that then the necessary research and innovation is being conducted, leading then towards having the information available for passing a safety and performance evaluation, so the obtaining the CE marking in Europe, into then actually move into what we have called an accessibility phase. And this accessibility phase is really aiming to bring your innovation into the health systems and looking at the different pathways. So within the countries, it's important to identify, or within the regions, it's important to identify which programs exist, and if any programs exist, to somewhat help to accelerate your innovation to be brought in. So what's the accessibility opportunities? Multiple regions, countries have programs which are being put in place to facilitate this. This can also be through the aspect of innovation procurement. It can be directly from payers' initiatives. So it's important to be aware of which are those and what are the expectations of those programs. There are others that you can really go directly into the into the hospital settings and see, okay, what's the interest of bringing innovation into the system. From their perspective, how are they interested to do so? And there might be others where you can go directly into the full system and getting into the reimbursement system to have then a continuous adoption being take place. But those generally are, I would say, more Me Too type of offerings which you are creating. If you really want to move into more advanced innovations offerings, it's important to be aware of the other initiatives. And then at the end of this phase, also, what value assessments will be done? Is this through a technology assessment, health technology assessment? So certain technologies will go through that process to be further uptaken into the system, which is then the reimbursement system, and have your continued financing stream. So it's very critical to lay this out very early into the process, having the necessary dialogues, looking at the appropriate jurisdiction regions to introduce it. Is this in more local? Is this in specific countries within Europe? Is this even potentially in the US? So it's important to look at that and to have there a clear pathway to be taken forward. So I'll hand over here to Rosanna.
Thank you, Yves. Okay, the first, again, I go directly with some examples. This example is a methodological approach that we are using in all PCPs and PPI we are coordinating. The first example, in fact, was the CIPHER, already in 2012, where we defined this methodological approach, how we define our unmet needs. This is really important because how we define our unmet needs will somehow also define at the end of the day which vehicle will be used to address these unmet needs. So we need to ensure not only that we know what stakeholders are affected by these unmet needs. So and so who is impacted, what are the main actors, to understand how they can be impacted if then we solve these unmet needs, but also we need to verify that these unmet needs really exist. If the solution we want to bring to our system makes sense. For instance, if we need to study to verify if sometimes they come to me saying, I want a mobile app, but if in the literature for this specific disease, for this specific healthcare journey, a mobile app do not add any value and has been demonstrated already by different pilot testing, maybe is not the need to really to develop a mobile app, but the need will be something else, defined from functional perspective, from pain perspective, where is the pain in your healthcare delivery, and then the technology we will see how we will address these unmet needs. And so we are talking about performance, maybe perspective also as well. And then there will be also an important step, there will be a feasibility analysis. By when we need these unmet needs addressed, how can we make sure that the deployment of this potential solution can be sustainable? How far we are from the state, what is the state of the art out there? Do we have a mature solution out there? And the most important part is the business case. When we are addressing these unmet needs, exactly can we justify this from investment perspective? What are we solving? What are we addressing? Is it it is a loss in our, I don't know, because we are inefficient, or it is an opportunity to improve our access to our healthcare service delivery, or it's an opportunity to make our healthcare service delivery more equal, inequity issue. So also this business case, the reason, or maybe we need to comply with the new regulatory requirements. This is very important. And then we have clearly, as I mentioned before, a dialogue with the market to understand how far the market is to deliver, and then we can decide if it will be R&D, research and development, if it will be a procurement of innovation, or a normal public procurement. I think that we need to go fast because it's just 15 minutes left. So I will skip somehow this slide just to tell you that clearly, as also Yves was mentioning his slides, one thing is when we talk about research and development agreements, preclinical, clinical investigation, and then when we want to escalate to the healthcare system, the health insurance, the payer needs to know really what value these technologies, these solutions, these innovations are bringing, to also think about if we need to cover, if we need to reimburse the new ways we deliver the healthcare service. The pathway for innovation access can be two-steps approach. As we were mentioning before, we have this risk-sharing agreement, risk-benefit sharing agreement through the procurement of R&D services. And then once we finalize this contract, we can engage in a PPI, in a public procurement of innovation. So we can then procure the fruits of the PCP through a public procurement of innovation. But also in any case, the Public Procurement Directive also offer other ways to then adopt solutions that give an answer to our defined unmet needs. In case there is a R&D exercise to be done, we can talk about this two-step approach that was mentioned before, but also the innovation partnership. And in case we are just talking innovation, procurement, we can go maybe through a competitive dialogue or a negotiation procedure with prior call for competition, or an open procedure once we have done a very detailed open market consultation. So really we have talked with the market, we have understood what the market can deliver. Yves.
So then indeed at the final point, but certainly not less important, is that now that we have actually provided the necessary value to the system, the question is then how to be rewarded for this innovation that actually is providing this value. So if we go on the next slide. And so within this analysis of the value proposition, if we look at the value as a combination of, from one end, all the outcomes that it is bringing, but at the other end also to look at the economic value that it provides, and economic value in the sense of the efficiencies, the addressing the waste into the system, because that's critical to have that addressed. To also see how people can be staying in a good health, because if you can be staying in a good health and to go into much more investing into the prevention side, you're of course avoiding a lot of costs downwards. And so in that way, it's also a major economic gain that you're having. And of course, you can look even more broadly into, okay, having patients in good health, also elderly in good health, what's the role that they can take up as care provision, so that you can have the people in the workforce actually staying economically active as well. So those analyses are important to be conducted. If we then move into the next slide, so then people can try to actually have all this information being developed, and in that way getting then into a transactional type of agreement. Or people can move really in a more collaborative approach and move into contractual agreements, which are going to look much more along the utilization also of what benefits are being provided, and have then incentives being provided to this. So moving to the next slide. Which is what I wanted to indicate there is that it's really critical to move into those types of value-based agreements. Rosanna, over to you.
Okay, so in alignment with what Yves was explaining, also in PP we did an analysis of the kind of results that can be a fruit of a public procurement of innovation initiatives. And these results are considered like an intervention. We have an inputs, we do activities, and then we come up with some results. Some results will be short-term results that are outputs, long-term results that are outcomes, and then we have a real impact in the society, or in the target population. And so we are talking about not only long-term results, but clearly also with specific evidence we can analyze. We did this analysis through different grey literature, including MIT, that I'm not now, I don't know why it's not here, but also including MIT, because at the end of the day, this exercise is very complementary with also what Yves was already explaining, and thanks to this exercise, now we are working with this framework of the procurement permeable to the value. Why? Because it's not when we define a procurement activity, we need to make sure that the value that we want to achieve is already embedded in all the procurement documentation. So not only the definition of the contracts or in the awarding criteria, but also in the template that the bidders are going to use to submit their bid, or in how we are going to monitor the contracts, the phase deliverables, the milestones, the expertise necessary also to evaluate the bids or to monitor the contracts. And every time it needs to be clear why we are asking for this, who we are benefiting, to who we are bringing the value. And so that also somehow the stakeholders categories are feel recognized in this procurement activity. We already did this exercise in 2 different PCPs, in Hong Kong GS that has been already issued, and also it's already been closed, and ticket that has already said is still need to be launched. So at the end, my conclusion is that to ensure that we bring the value to the different stakeholders, we need to make sure that the business case, why we are making this procurement initiative and the business model for industry, from the industry side, are aligned along the full value chain. And so the planners and the staff needs to be aligned. So we have the patients, the carer, the healthcare professional, the healthcare providers with their budget, with their time, the healthcare system, the society, and the industry. And this time the industry will not, maybe they can get also support from some investors or from some business angels. And I'm trying to be fast. Examples that we have for the business case, we have a good one from anti-superbugs, where you have the perspective, from the very beginning, the call for tender. We say, look, we are in this phase, we are in the phase, then there will be a phase that you will need to get a certain certification, and then you have the commercialization phase. And so also in which phase, what we expect from you, what are the outcomes and the outputs that we expect from you, and also a long-term vision. In the best case scenario, we want to address, for instance, in the case of this buyer that was ECO, the admission lost due to most prevalent multi-drug resistant organism. In the case of Provincia Autonoma di Trento, was to the difference, the cost, reduce the cost of the extension of length of stay of the patients when they are infected with multi-drug resistance. And then we have the Rimocor example that was somehow mentioned, not because it's not unique, but a similar example from Yves in the very first set of slides, when we are changing the way to buy technology from unit cost to a service cost. And so at the end, we are measuring the contract on the outcomes that we receive from this transformation. And we are going to pay, there is a percentage of the overall contract volume that is based on the outcomes that have been achieved. And this is also defined in the call for tender. So conclusion, Yves.
Okay, so in conclusion, so I think what's clear, hopefully, after this 1 hour, is that it's really time to partner among the stakeholders to realize the full potential of a value-based procurement, for the providers and procurers to drive this this concept, to really then look at the comprehensive value perspective related to the outcomes and the cost of care across the pathway, for the suppliers to develop an evidence-based value proposition to address provider needs and enable their own teams for a value-based selling, and for the system to foster the collaboration across stakeholders, incentives, enabling actually the value, incentivizing the value, and enabling the digitalization, which is increasingly important. Next one.
Right. Well, in my case, is clear that we have an opportunity to transform the healthcare delivery value chain and maximize the value across the stakeholder affected by the given innovation through procuring demand-driven innovation. So really, the key is introducing innovation in a way that once we define the innovation, we already know what value we are going to expect, defined by stakeholders, and to ensure that this is from the very beginning, from the definition towards the end, when we have the access to the health system, that we deploy the solution, we can monitor that really we are achieving this value. And this is a very great opportunity. So let's do it.
Okay, thank you both for such detailed presentations. Rosanna, if you can stop sharing screen, maybe I probably can see. Yeah. So I know it's late and we have just 3 minutes, but there are several questions from the audience, and I'd like at least to pose one if you would like. So someone is asking, what is the relation between value-based healthcare and economic health evaluations?
Yeah, you want to take it? I'm happy to provide as well. Huh?
Okay. Well, really, the economic health evaluation, you're looking at, again, a cost efficiency, cost effectiveness, and this is something that we are already doing. When we evaluate any intervention or any technology that we are incorporating or adopting in the health system. But as we were mentioning, Yves and I, at the very beginning of this presentation, we are not just talking about health economic, cost effectiveness, cost efficiency, cost utility, because it's not just a matter of cost. What is the value that we are really bringing to the patients? We are increasing their autonomy. What is the value that we are bringing to the healthcare provider? So regarding all the healthcare professionals or the health system, is our health system more equitable? So at the end, this economic evaluation, sometimes they're losing part of the aspects of the outputs that increase really the value and the benefits that we're giving to the different stakeholders.
Okay, understand. And just maybe the last and quick question: how can startups benefit from applying value-based healthcare? Is this an advantage, or because you talked
I
about
leave this to you.
Providers a little bit?
Yeah. So I think if you as a startup don't really have a very clear view of what's your true value proposition to the system, then you're going to face a lot of challenges when trying to actually get the technologies introduced into the system. So I think the major benefit is that you need to do a very, very early value proposition analysis in order to really see what ultimately is it that you're offering in response to the needs, not what you can do, but really how is this what you're offering going to be really of value, of benefit, and differentiate yourself from all the rest, so that you stay out of commoditization, out of the question of ultimately like, okay, why should we invest extra in your innovation? So it's very, very critical to do this otherwise you're just staying into the old model, which is developing beautiful innovation, which is ready to be put on the shelf, but not to be used in the system and not to be rewarded for that. Which is something, if you like to do that, great, but I think that's not your primary purpose.
Okay, thank you very much for your answer. So now it's 12 o'clock, so I wouldn't want to be late. I appreciate all your insights that you have given to us, all the attendees for being here. And there's several questions that we couldn't reply, but if you don't mind, maybe we can email you, maybe you can give us a short question and we can email everybody with this question, with these answers, if you don't mind. Okay.
Yes, happy to do it. Thank you.
Great. Thank you very much. And everybody have a nice day. Bye-bye.
Thanks. Bye-bye.
Bye-bye. Thank you.